The physicians' syndicate in Egypt called for the intervention of President Abdel Fattah el-Sisi to change the instructions of the Ministry of Health regarding the protocol of procedures for examining contacts of members of the medical team infected with the coronavirus. In its speech, the union said that at a time when cases of infection among medical staff of the coronavirus are increasing as a result of contact with patients, and instead of taking further protection measures for doctors and the rest of the medical team, the Ministry of Health surprised everyone by amending the protocol of examination procedures and smears of contacts of members of the medical team. She pointed out that many doctors in many quarters submitted complaints to the General Syndicate after the publication of the General Administration of Infection Control on May 12, 2020, stating his instructions that in the event of positive cases appearing among medical personnel, smears are not taken from contacts and not authorized to isolate contacts with both at home or in terms of work, and for workers to do a self-assessment for themselves, hyperthermia, and to notify the employer to conduct the examination. The syndicate stated that the publication added the phrase, "The most infection among hospital staff is caused directly by the community contact between the staff, housing, food places, doctors and nursing breaks, which means trying to hold the medical team members responsible for their illness in a strange precedent that did not occur at the level of the world." The doctors' syndicate described these instructions as very dangerous because they mean that a member of the medical team carrying the infection before symptoms appear will be allowed to work and socialize with others, which will necessarily lead to a greater spread of infection among medical personnel, who in turn will transmit the infection to their families and citizens. And she continued, instead of the medical team member providing medical care to the citizens, he himself will become a source of infection, which threatens a real medical disaster. The union pointed out that it is not permissible here to measure what is happening in some other countries of the world, because there is no comparison, in terms of providing all means of prevention and infection control and follow-up on their actual use, as well as preparing accommodations and breaks for doctors and workers. Source: Egyptian media.